Assalamu alaikum, students. So we are going today, we are starting today a series of videos regarding the MCQs of the various chapters of the Ross and Wilson for nursing students. So today we will start from the cardiovascular system, and in cardiovascular system, some topics will be discussed in this video. So regarding the arteries and arterioles, which of the following correctly describes the structure and function of the arterioles? So in this MCQ, the question is the structure and function of the arterioles. So they contain more elastic tissue in the tunica media. They are absorbing pressure waves from the heart. Their tunica media is made mostly of smooth muscles to control diameter. They transport blood towards the heart under the low pressure, and they have thinner walls than the veins to reduce resistance. So basically, arterioles have got more smooth muscles in their tunica media to control their diameter. So the arterioles are also known as the resistance vessels. So the correct answer is the C. So second MCQ, large arteries such as aorta contain more elastic tissue than smooth muscles in their walls to reduce the overall blood volume, regulate systemic blood pressure, allow the vessel wall to absorb pressure waves, prevent blood from returning to the heart, slow down the flow of blood to the capillaries. So, large arteries such as aorta. So, large arteries, example of large artery is the aorta. Example of large artery is the aorta, which is also known as the elastic artery because they have more elastic tissue in their walls. So, what is the function? So, what is their function? Why they have more elastic tissue? To reduce the overall blood volume, to regulate systemic blood pressure, allow the vessel wall to absorb pressure waves coming from the heart, prevent blood from returning to the heart, and slow down the flow of blood to the capillaries. So again, the correct answer is the C, which is the to allow the vessel wall to absorb pressure waves. So next question, which which layer of the artery is composed of squamous epithelium and lines the interior of the vessel? Tunica adventitia, media, intima, myocardium, endocardium. So here the three layers of the vessel wall, that is the tunica intima, tunica media, and tunica adventitia. Now this myocardium and endocardium is the wall of the heart. So myocardium is the tunica media and endocardium is the tunica this intima. So the question is asked about an artery. So the wall of the artery composed of these three layers, and in these three layers, the squamous epithelium is present in the tunica intima. So why are arteries thicker than veins? They carry deoxygenated blood. They contain valves to prevent backflow. They transport blood at low pressure. They must withstand high pressure from the heart. And they are located deeper in the body. Arteries are thicker than veins because they must withstand high pressure from the heart. So arteries got high pressure of the blood while veins are at low pressure. So D is the correct answer. What is the primary function of the tunica media in the arterioles? So again, question regarding the function of the tunica media in the arterioles. So what is an arteriole? This is a smaller vessel than the artery, small artery. And what is the primary function of tunica media? Now, tunica media of arterioles composed of mainly of the smooth muscles. So, to protect the vessel from external damage, to provide elasticity to absorb pressure waves, to regulate vessel diameter and blood pressure, to allow exchange of gases and nutrients, to anchor the vessels to surrounding tissues. So, correct answer is the to regulate the diameter and blood pressure. Next question. Why are the arterioles referred to as resistance vessels? So, arterioles are also known as resistance vessels. Because they offer little resistance to blood flow, they prevent blood from flowing backward. They generate the pressure needed to circulate blood. Their narrow diameter creates resistance to blood flow. They absorb pressure waves from the heart. So, arteries have small diameters and muscular walls that regulate resistance to blood flow, thus affecting the blood pressure. So, correct answer is the D. In which type of arteries is the tunica media richest in elastic tissue? So again, I have told you in the beginning, the aorta, which is the large artery, elastic artery. So their tunica media contains more elastic fibers than the smooth muscles. So correct answer is elastic arteries like aorta. Which of the following best describes the tunica adventitia? This is a layer of squamous epithelium lining the vessel, a muscular layer responsible for vasoconstriction, a fibrous outer layer providing structural support, a layer rich in valves for preventing backflow, and smooth layer that allows diffusion of gases. So it is a tunica adventitia is a outer fibrous layer that provides strength and support to the vessel. So this is the outer layer, outermost layer tunica adventitia, and it provides support to the outer layer, to the vessel. What structural feature primarily allows large arteries to absorb pressure surges from the heart? तो लार्ज आर्टरीज में ऐसा क्या है जो उनको हार्ट के प्रेशर को एब्जॉर्ब करने में हेल्प देता है? तो a tunica media rich in elastic tissue. Correct answer is a thick tunica intima, a high smooth muscle content, a thin tunica adventitia, a tunica media rich in elastic tissue, and internal valves. So the correct answer is the thin tunica, a tunica media rich in elastic tissue. Now, the second topic of this chapter, anastomosis and end arteries. What is the primary function of the arterial anastomosis? To increase blood pressure in tissues, to slow down the flow of blood, to provide an alternate route for blood flow, to remove waste from tissues, to restrict circulation of to the specific area. So what is the primary function of the arterial anastomosis का primary function क्या होता है? So it is to increase blood pressure in tissues, to slow down the flow of blood, to prevent and or to provide an alternate route for the blood flow. So anastomosis allow for collateral circulation. If one main artery is blocked, so it provides an alternate route for blood flow. The correct answer is it to provide an alternate route for blood flow. In which of the following locations are arterial anastomosis commonly found? Retina of eye, palms of hands and soles of feet, lymph nodes, skeletal muscles only, inner ear. So correct answer is palm and hands, palm of the hands and soles of the feet. Anastomosis are common in the palm, sole, brain, joints, and parts of heart. Why is gradual occlusion of an artery less likely to cause tissue death in an area with anastomosis? So, what is the question? Understand the question first. When there is a gradual occlusion of an anastomotic channel, so why the tissue damage is less? Because veins can reverse blood flow, because the heart increases blood pressure to compensate, because anastomotic arteries can dilate over time, because the tissue needs less oxygen, because nerves stimulate tissue repair immediately. So this is because with time anastomotic arteries can dilate and maintain adequate blood flow. What characterizes an end artery? It is the largest artery in the region. It is located only in the limbs. It is the sole supplier of blood to the tissue. It has many branches and connections. It functions only during exercise. So correct answer is three. It is the sole supplier of the blood to a tissue. End arteries are the only blood source to the tissue. Blockage causes death. What is potential consequence of occlusion of an end artery? So what will happen when an end artery will occlude? Tissue repair is accelerated, collateral circulation prevent damage, tissue supplied by it may die, blood is diverted into lymphatic system, blood pressure in the body decreases significantly. So correct answer is the tissue supplied by it may die. Since there is no alternative blood supply, the tissue can die from an end artery when an end artery is blocked. Which of the following is an example of an end artery? Aorta, pulmonary artery, femoral artery, coronary arteries, and central artery to the retina of the eye. So, central artery of the retina is the correct answer. Which structure in the brain receives blood from end arteries? Medulla oblongata, circle of Willis, cerebellum, spinal cord, temporal lobe. So, circle of Willis receives blood from end arteries. The central artery of retina is an example of end artery. What happens when it is blocked? So again, what happens? The retina experiences increased blood flow, no change occur because collateral circulation takes over, body produces new arteries to compensate, tissue supplied by the artery dies due to lack of blood supply, and blood flow is redirected to optic nerve. So the correct answer is the tissue supplied by the artery dies due to lack of blood. Which of the following areas relies on the end artery for its blood supply? So basically, the question is where the end arteries are present in the body. Muscles of the legs, liver, skin on the hands, central region of the retina, kidneys. So correct answer is the central region of the retina. Which condition is most likely to result from occlusion of an end artery? Edema of the surrounding tissue, hypoxia leading to tissue death, increased pressure in the venous system, lymphatic drainage of the affected area, improved circulation from the collateral vessel. The correct answer is the occlusion of an end artery can cause hypoxia, leading to tissue death since there is no alternative blood supply. What is the primary function of capillaries? To carry blood away from the heart, to serve as a reservoir for blood, to exchange substances between blood and tissue fluid, to regulate blood pressure, to filter blood before it enters the veins. The correct answer is the to exchange substance between blood and tissue fluid. Which of the following correctly describes structure of the capillary wall? They consist of multiple layers of smooth muscles. They have thick basement membrane and multiple layers of endothelial cells made of single layer of endothelial cells sitting on thin basement membrane. They contain large pores for blood cells to pass through, lined with squamous epithelium and smooth muscle. So correct answer is made of single layer of endothelial cells lying on a thin basement membrane. What is the diameter of a typical capillary? So correct answer is 7 micrometer. Which of the following regulates blood flow into capillary beds? So correct answer is precapillary sphincters. Precapillary sphincters are present before the in the met arterioles before the capillary bed, and when they constrict, they regulate the blood flow in the capillary bed. When do precapillary sphincters dilate to increase blood flow? During high blood pressure, when blood glucose levels are high, in response to hypoxia or high level of tissue wastes, during periods of rest when blood flow is too slow. So correct answer is in response to hypoxia or high level of wastes. Which of the following is not a characteristic of sinusoids? They are wider and leakier than normal capillaries. So the basically in this question we have to identify the point that is not relevant in the sinusoids. So sinusoids are wider and leakier than normal capillaries. The lumen is much larger than normal capillaries, correct. This is also correct. They allow blood to come in direct contact with the cells outside the sinusoidal wall, correct. They carry blood at high pressure. So this is the sinusoidal capillaries carry more slowly and under less pressure, blood more slowly and under less pressure, allowing for better exchange between blood and the tissue. And of course, they are found in liver and bone marrow. So the correct answer, which is not the characteristic of a sinusoidal capillary, is that they carry blood at high pressure. In which of the following organs are sinusoids commonly found? So correct answer is liver. What allows faster exchange of substances between blood and tissues in the body? Increased blood pressure, larger diameter incomplete wall, more smooth muscle in their wall, higher oxygen level in the blood, precapillary sphincters, presence of precapillary sphincters. So sinusoids have larger lumen and incomplete wall, allowing blood flow more slowly and enabling faster exchange with the tissue. What is the role of precapillary sphincters in regulating blood flow? So again, to prevent blood from flowing into the capillaries, to maintain constant pressure within capillaries, to direct blood flow into or out of the capillary beds based on tissue needs, to control exchange of gases in capillaries, to pump blood into the venules. So, role of precapillary sphincters, they control blood flow into capillary beds based on the metabolic needs of the tissue, as during hypoxia or increased activity. So they direct blood flow into or out of the capillary beds based on the tissue needs. The correct answer is that C. Which type of blood vessel is directly involved in nutrient and gas exchange between blood and tissue? So of course the capillaries. That's all for today. I hope you find this helpful. Thank you so much.